Puneeti, you should be ready now with your sharing. Puneeti, you want to share that video something or? Yeah, perfect. So thank you all for joining today's webinar. It's 11:02 Eastern Time, and we will start our session soon. Let others join. So we'll wait a couple of more minutes, and we will start our session 11:05 sharp. So thanks again for joining this session, and we have all the doctors with us.
Voice is very low.
Uh,
Voice is very low.
Is it better, Dr. Samarth? We can hear you very well, Dr. Samarth. So we will record this session. Puneetji and Hiteshji, please make sure we record the session. So thank you all for joining this webinar. Please mute your lines. We will start our session in just 1 minute. It's 11:04 Eastern Time. We'll start our session 11:05. Like a couple of people gonna join soon. So I wanted to give them the opportunity as well. So right now we have 17 people here. Let's see if we can have some more people join at the last minute, and we'll start soon. So once again, welcome you all. It's 11:06 Eastern Time, and we are recording this session. Let's go ahead. So good morning, everyone. I hope you all are healthy, safe, and having good time with your family members and friends. My name is Dr. Madhu Nimani, and I am the VT Seva Director of Atlanta branch. And I welcome you all to this webinar of Emergence and Spread of Omicron, Allopathy, Homeopathy, and Ayurvedic Perspectives. For today's webinar, we have the expert doctors with us in the field of allopathy. We have Dr. Jawahar Ghazala, Dr. Hans Kai. In the field of homeopathy, we have Dr. Samarth Chopra. In the field of Ayurveda, we have Dr. Neeraj Srivastav. I truly thank all four doctors for taking time from their busy schedule and helping us and sharing the insights in regards to their specialization. My heartfelt thanks to all the four doctors here. We have great audience today. Right now it's 21 participants, I can see that. And people are connected all across US and they are ready to seek your guidance. And they need how to deal with Omicron and win over Omicron. We all can do it. So I heartily welcome you all to all my listeners of this webinar. Before starting the webinar, a couple of housekeeping points here. Please mute your lines while the presentation is going on because doctors will be presenting their slides. So please keep muted. And later on in the Q&A section, you will be asked to answer all your questions and they will answer all your questions. You can start putting your questions in the chat presentation while the presentation is going on, and they will later address all your questions. And if there is any technical issues or connectivity issues due to bad weather in Atlanta, it's snowing today. It's a wonderful weather outside, but because of that, if there is any technical glitches, please stay connected. And we truly appreciate your support and understanding in this regard. Before we begin our COVID Omicron webinar, let me share high level about VT Seva. Most of you already know VT Seva. So VT Seva stands for Volunteering Together for Service. And in Atlanta, our youth and adults have done a wonderful job in 2021. So before we start the webinar, let's see what they have done in 2021. And after that, we'll start the webinar. So Kunichi, would you like to please play those initiatives of 2021? Thank you. Yeah, hello, this is Corey. Corey, you want to introduce yourself?
Hello, I'm Corey Jackson. I am the interim CEO of Laurel Heights Hospital. First of all, I want to say a big thank you for everything that you guys have done for us thus far. The mask that you have prepared for us today came just right on time for our organization. We are currently dealing with a few cases of the coronavirus throughout the facility, and these masks will help protect and keep our children and staff members safe. Thank you. Have a good afternoon, day. I don't know when you show this.
Thank you. Thank you so much. And now here is our favorite, Patrick. So Patrick, any message for our children?
You guys continue to surprise me and just continue to excite me for all the things that you're doing. From the bottom of my heart, as well as Laurel Heights, we appreciate everything that you all are doing for us, with us, and we're going to continue to have a very long-lasting relationship. So thank you guys for everything.
Awesome. Thank you, Patrick. And we enjoy the partnership. We enjoy the collaboration. And now come.
Hi, Dr. Smita Batula. I'm one of the physicians at Laurel Heights Hospital. Thank you, parents and children, of course, Madhu, Anu, and the whole VT Seva team for bringing the masks, especially on time. Again, this is a crucial time we are in need of the masks because we had a COVID outbreak in our facility, and so this is second or third wave, whatever they call, and we had an outbreak. So, and thank you, and this will help and protect and prevent the spread of COVID crisis in our facilities. And so thank you so much again. And this is especially more, I think, precious because it is from children to children. And so thank you again. I cannot thank enough for these lovely children who is making these masks. So thank you, VT Seva, for giving all the support that they have been giving for the past 1.5 years.
Awesome. Thank you.
Puniji, your audio is muted.
I'll throw it for that batch and I'll be back. Okay. Please come back. They upped it to 1,500 this time.
జై శ్రీమన్నారాయణ Jai Shrimanarayana Madhuji, video is not working, audio is not working.
Yes, that's a technical glitch, Shantiji. The person is playing, but it's not working. Sorry.
So they'll have to ask them to try one more time. When they share the video, they'll have to select the option as share with
if you want
audio.
to lead something, start by saying, this is...
Okay. So Puniji, can you please play it again?
Sir, when you share along with video, there is a small place where you can select, the checkbox will be there, share audio.
Sorry for the inconvenience, everybody. We'll start our session soon.
No worries. This is expected in the virtual world.
Yes, I'm just correcting it. I selected it, but I don't know why the audio went back, but I'll do it again.
Yeah, thanks, Puniji. So while we are waiting, let me welcome you all once again to this webinar. Unichi, whenever you are ready, you can share. So this video is high level about some of the initiatives of Atlanta VT Seva in 2021, just to encourage our youth to keep doing what they're doing. Yeah. Hello, this is Corey. Corey, you want to introduce yourself?
Hello, I'm Corey Jackson. I am the interim CEO of Lower Heights Hospital. First of all, I want to say a big thank you for everything that you guys have done for us thus far. The mass that you have prepared for us today came just right on time for our organization. We are currently dealing with a few cases of the coronavirus throughout the facility, and these masks will help protect and keep our children and staff members safe. Thank you. Have a good afternoon, day. I don't know when you will show this.
Thank you. Thank you so much. And now here is our favorite, Patrick. So Patrick, any message for our children?
You guys continue to surprise me and just continue to excite me for all the things that you're doing. From the bottom of my heart, as well as Laurel Heights, we appreciate everything that you all are doing for us, with us, and we're going to continue to have a very long-lasting relationship. So thank you guys for everything.
Awesome. Thank you, Patrick. And we enjoy the partnership. We enjoy the collaboration. And now come.
Hi, Dr. Smita Batula. I'm one of the physicians at Laurel Heights Hospital. Thank you, parents and children, of course, Madhu, Anu, and the whole VT Seva team for bringing the mass, especially on time. Again, this is a crucial time. We are in need of the mass because we had a COVID outbreak in our facility, and so this is second or third wave, whatever they call, and we had an outbreak. So, and thank you, and this will help and protect and prevent the spread of COVID crisis in our facilities. And so thank you so much again. And this is especially more, I think, precious because it is from children to children. And so thank you again. I cannot thank enough for these lovely children who is making these masks. So thank you, VT Seva, for giving all the support that they have been giving for the past 1.5 years.
Awesome. Thank you. So sorry, there is some audio issues here again. These are some of the projects which our Atlanta VT Seva have participated. You can see the Independence Project. This is Meals by Grace project, where our children goes and participate. This is the Shubha Kickoff. And this is for American Heart Walk. That was on October 2nd. This is a kindness project that we participated at the national level. And here comes Shubha. So this is our annual event. And we have plethora of dances and Shubha's skit here. It's a really good teamwork of Atlanta team, and youth did an active participation here. So it was blessed by Swamiji, and I think because of which it was so successful. So again, I'm really sorry that the audio part in the end didn't work again. I think it's bad on our side, so I sincerely apologize for that. But let's move forward. So I welcome you all to this webinar. My name is Dr. Madhu Nimani. I am the director of VT Seva Atlanta. And today we are here for this webinar, Emergence and Spread of Omicron, Allopathy, Homeopathy, and Ayurvedic Perspectives. And to some of you who joined late, there's a couple of housekeeping points here. Please keep yourself muted until the presentation is done. And then in the Q&A, you will be asked to ask your questions. You can write your questions in the chat while the presentation is going on. So this will help our doctors to present their insights, share their insights on allopathy, homeopathy, and Ayurveda. So it's my esteemed honor and pleasure to introduce you all to these panel doctors. Let me start with Dr. Jawahar Ghazala. He's a cardiologist by profession. He is part of Atlanta Heart Specialists, Atlanta Metro, Georgia. He has been an active participant in teaching and educating the people during the pandemic. He will provide introduction and updates on epidemiology of the Omicron variant. Dr. Hans Kai, he's endocrinologist, researcher, and associate professor of medicine, Department of Endocrinology, Diabetes, and Metabolism at University of Florida, Gainesville. During his pandemic, he has put on an epidemiologist hat and has been very actively involved in COVID education. He will be talking about the guidelines of prevention and treatment of COVID. We also have Dr. Samarth Chopra. He is an expert in the field of homeopathy. He's a medical officer, Homeopathy Department of Ayush, Government of Haryana, India. He is a visiting faculty of Department of Ayush, Saran Ashram Hospital, Dialbagh Educational Institute, Agra. He has treated thousands of patients through his homeopathy advice during this pandemic, and he will be sharing his insights on homeopathy perspectives. We also have Dr. Neeraj Srivastava. He is Professor, Head, Department of Bal Rog, Ayurvedic Pediatrics at Himalaya Ayurvedic Medical College at Dehradun. He is an active researcher in the field of Ayurveda. He has also an active researcher in creating Prakriti assessment software. He has helped a lot of patients through telecommunication mode, sharing his Ayurveda insights. He will be presenting on Ayurvedic perspectives. So without any further ado, let's start the webinar. Dr. Jawahar, floor is yours. Thank you. Dr. Jawahar, can you unmute yourself?
I got it, yeah. Thank you, Madhuji, for your kind introduction. Welcome, everybody. It's been an eventful last 2 years, and these 2 years have tested our patience and resilience. And hopefully, with God's willing, hopefully there will be no other dangerous variant that comes out, and we'll all get through this pandemic without any further problems. And welcome to this talk again on Omicron. So Omicron is an explosive and the fastest spreading virus known to human mankind. It's the fastest spreading virus we have ever seen. We always have a benchmark of measles as a fastest spreading virus, but this has put measles to shame. And as you can see here in the timeline, on November 24th, 2021, the first specimens of Omicron variant were identified from Botswana and South Africa. And the first case was confirmed in US on December 1st. And within this period of 6 to 8 weeks, this has become the dominant strain almost everywhere in the world. That's the speed of this virus. And Omicron now accounts for more than 98% of all COVID cases in USA. It has about 50 different mutations all over its genome, and 30 mutations, especially in the spike gene. This makes it special when compared to the Delta variants or the Alpha variant or the native COVID prior to this. Now, look at this chart carefully. You can see here, this is the daily new confirmed COVID cases in United States and India. You can see this Delta variant in India with its peak. This is the Delta variant in United States. This is the prior Alpha variant. You can see the steep curve of daily number of cases accounting to about 800,000 per day in United States. And in India, it's around 200,000. It's grossly underreported for sure. So you can see this steep curve, the steep takeoff on the number of cases per day of COVID-19. Now, this is happening when our population, or like, for example, if you see at United States is 70% vaccinated, and India is 60% vaccinated with at least one vaccine. And if you take like prior infections into account, about 80 to 90% of all population in at least in United States and India has immunity. In spite of this, we are having such a steep takeoff in the number of cases. And you can imagine the speed of this variant. Now, this is United States data. You can see the number of cases in United States take off. This is the Delta variant. This is the Alpha variant. Now compare that with the hospitalizations. The percentage of hospitalizations for the number of daily cases is not that much when you compare to the Delta variant here versus Alpha variant here. At the same time, even the deaths are not that much as a percentage of total number of daily cases compared to the Delta variant here or the Alpha variant here. So that's another data we can process from the charts here. The same is going on in United Kingdom. You can see the daily confirmed cases very high compared to the Delta variant and Alpha variant, but the number of hospitalizations and deaths are not that high. Same goes with Israel, which has given, in some of them, it has given the second booster shot. That is total of 4 vaccines shots they have given in some patients. And even there, you can see the steep spike in number of cases, but not much in the hospitalizations and deaths. Now, let's ask a few questions about Omicron. Is Omicron transmitted more easily? Yes. So we have seen the data, and I've shown you the data, and you can see the steep takeoff compared to the Delta variant and Alpha variant. And this is very easily transmitted than the prior variants. As I said, it's the fastest spreading virus known to mankind. One case of Omicron can give rise to 6 Omicron cases in a span of 4 days and 216 within 12 days. That's the speed of this virus. The mutations on the spike protein of the virus, they help the virus in entering the cell easily and also replicating it faster. And this increases the speed of the Omicron process. And at the same time, Omicron seems to infect the cells in the upper respiratory tract, that is the bronchus, the larynx, and the nasopharynx regions at a high numbers compared to the Delta variant, which better replicated in the lungs, and thereby it was very dangerous. Now, because of all these reasons, Omicron has a very short incubation period. Delta variant took at least 5 days for the onset of symptoms from being exposed, but Omicron does it within 3 days. So you get exposed within 3 days, you start to have symptoms. And also, if you look at it, the symptoms of sore throat and especially runny nose has been more in Omicron compared with the Delta, where Delta affected the lungs more. And also Omicron can infect people at a very low dose, exposure dose compared to Delta, and that's why it spreads faster. And the second question we can ask is, does Omicron cause less severe illness? Yes. Here is the data, very good data from Kaiser Permanente in South California. Compared to Delta, which is in the blue here, Omicron is in the green, there is 53% reduction in symptomatic hospitalization, 74% reduction in risk of ICU admission, and 91% reduction in risk of mortality. But the key factor here is, as we talked about, 80 to 90% have some natural immunity to this Omicron variant. And because of that high likelihood, this is causing less severe illness. So the people who have not exposed to who had no prior COVID infection or who have not had any vaccinations can have very severe disease as comparable to Delta variant. So it's very important to keep that in mind. Now, the third question we can ask is, will existing COVID-19 vaccine or prior infection work against the Omicron variant? The answer to this is yes. Even though Omicron is evading natural immunity, vaccination, and other monoclonal antibody treatments, even though we are getting even after a booster shot, but because of these vaccines and booster shots, we are having less severe infections. And it is said that the vaccine effectiveness of 3 doses of the vaccine is about 88% for hospitalization. And for those who are unvaccinated, they are 20 times likelier to die, 17 times likelier to get hospitalized, and 10 times likelier to be having symptomatic infections. And this is the data right here on the right-hand side from Israel. And the red line is the ones who have not gotten the booster doses. They got the vaccines, but they have not gotten the 3rd dose, the booster. And the blue line is the boosted ones who got the 3rd and 4th vaccines. You can see the number of symptomatic infections are less in people who got the 3rd booster or the 4th booster. The first booster and the 2nd booster. And at the same time, even asymptomatic infections are less in people who have been boosted. And the 4th question we can ask is, will existing COVID-19 treatments work against Omicron? Now, some of the treatments are not working. it's been a real shame, especially the monoclonal antibody therapy, which we have used to great success in the Delta variant. There were at least 3 monoclonal antibody treatments, one from Regeneron, the second from Eli Lilly, and the third one was sotrovimab. And we were using the Regeneron and Eli Lilly one to great effect. But then comes the Omicron, and this MAB therapies do not work against Omicron, and we have completely shut down the programs. Except sotrovimab is said to work against it, but but it's a little bit less effective. Remdesivir is supposed to work because it's an antiviral, but on the horizon, they've come out the new drugs, the Paxlovid and Lagevrio from Merck. They should be equally effective in Delta and Omicron, especially Paxlovid, which is showing great promise. And in the inpatient setting, remdesivir, tocilizumab, and steroid are expected to be equally effective for the Delta and Omicron. Now, I want to take time and talk about this new antiviral drug that came out, Paxlovid from Pfizer. It's very promising, and it may end up like the Tamiflu for flu going forward. At this moment, this drug is available in Atlanta, all over United States. It can be given for 12 years and older. They should be 40 kilos. They should have a positive test. There should be people who are expected to progress to severe COVID-19, which means hospitalization, death, basically high-risk people and unvaccinated people. It's given at, there are 3 tablets. You have to take it twice a day for 5 days. It should be started within 5 days of symptom onset. The main side effects are not that much. You should talk to your doctor if you have liver problems. It can cause liver problems, altered taste, diarrhea, little bit increase in blood pressure and muscle aches. It's very promising in the sense it cuts hospitalization and death by 89% compared to a placebo. But it cannot be given in pregnant women or breastfeeding people. So talk to your doctor before you want to pursue this. Now, as compared, the Merck drug, molnupiravir, can be given in 18 years and older, not 12 years, 18 years and older. They should have a positive test. There should be people who will progress to severe COVID-19, hospitalization, death. It's given at 800 milligrams twice a day for 5 days, just like Tamiflu and Paxlovid. It has to be started within 5 days of symptom onset. Side effects are minimal: diarrhea, nausea, dizziness. But it seems to be, at least from the data, not very effective. It cuts the risk of hospitalization by 30%. And in the trial, there were 9 deaths in the placebo group as compared to 1 death in the molnupiravir group, which means that it cuts the chance of death by 8-9%, but hopefully it does it. It's still new, so it's not recommended in people who are pregnant and breastfeeding. Now, the FDA, as an outpatient, if you are the one who's going to progress to have severe COVID infection, then the order of preference you should try to get, the drug's order of preference would be, first try and get Paxlovid as soon as you're tested positive. And if you're at high risk, if you're unvaccinated and you have all the risk factors, try to get Paxlovid. If it's not possible, then you can try to get sotrovimab. If not, then as an outpatient infusion, remdesivir. If not, molnupiravir. So that's the order of preference you should try. And the key take points from my presentation is Omicron spreads faster and it has shorter incubation period. It evades natural immunity. It's evading vaccination and monoclonal antibody treatments. Omicron causes less severe infections, but only in patients who have been vaccinated, had prior infection, or have been boosted. And availability of oral antivirals is a blessing, and hopefully that will help stop the pandemic. Thank you, and I'll give the baton to Dr. Hanskai.
Thank you so much, Dr. Jawar. Really appreciate that. And before I begin, I wanted to commend VT Seva for the excellent community service that they've been doing for everyone around the region. I also want to thank VT Seva for giving me this opportunity to be here with you today. As Dr. Ghazala mentioned, the Omicron variant is a fast-spreading variant. And in that regard, it is important for us to be aware that since this is a fast-spreading variant, that we might be exposed to people that may have COVID-19 infection, and we need to figure out what we need to do for ourselves or our loved ones if we are exposed to somebody who has COVID-19. So let's take a look at various scenarios. One scenario is if we are exposed to somebody or we come in contact with somebody that has COVID-19 infection and we are not up to date on our COVID-19 vaccination, what should we do? Well, the first thing is this: we should quarantine ourselves for at least 5 days, stay at home, obviously get tested to make sure that we are not testing positive for the virus. And even if you don't develop symptoms, make sure that you're getting tested at least 5 days after you've had last contact with that person that had that COVID-19 infection. Obviously, we would be taking precautions like wearing a mask, avoiding travel, and avoid being around those people that would be at higher risk of catching the virus from us. For example, those that are elderly, those that are immunocompromised, taking steroids, for example, or undergoing chemotherapy. And it's important that we do this for at least 10 days. So if we look at another scenario, suppose that we are up to date on our vaccination and we are exposed to somebody that has COVID-19 infection. What do we do then? Under that circumstance, the Centers for Disease Control recommend that we do not necessarily need to quarantine. You do not need to stay at home unless you develop some symptoms. It is important that we do get tested for COVID-19 at least 5 days after you've had last contact with that person that has had an active infection. And obviously watch for symptoms for at least 10 days since you've had contact with that person that has an active COVID-19 infection. Now, if we look at the scenario of us being up to date on our vaccination, we're exposed to somebody with COVID-19, but we do develop symptoms. Under that circumstance, we should isolate immediately and get tested. And we need to continue to stay home until we get the results of those testing. So if we do that, we would obviously during that time period wear a mask, avoid travel, avoid being around people that would be at high risk that we talked about earlier. Now, obviously, we would take these precautions for at least 10 days since our last exposure to that person that had COVID-19. So if we can go to the next slide really quick. If we do test positive for COVID-19 or have symptoms, regardless whatever our vaccination status is, it's important that we stay home for 5 days and isolate from others in your own home. You may also want to consider getting testing before going to work and wearing a mask, avoiding travel, and avoid being around those that are at high risk. If you have severe infection, it's important that you isolate for at least 10 days and obviously consult with your doctor before ending your isolation. So I think these are really important steps to take. And when we're thinking about isolation, we are essentially staying in a separate room from other family members. we're in an ideal setting using a separate bathroom from other family members and not sharing the same types of utensils either. If we can also move forward on the slide deck, I apologize. And it's also important that we keep the house well ventilated. That basically means keeping your windows open, having that ceiling fan on, and any window exhaust so that you can blow that air out of the room so that you're able to keep those virus particles from just accumulating in a concentrated form in that room. And it's important that we also wear a mask, especially around those in our home. And we don't want to expose other family members that don't have the infection. And it's important that when we are wearing a mask, that we are wearing a mask that has several layers to it, that's completely covering the nose and the mouth, and that is fitting snugly against the sides of your face, and you don't have gaps. There are various scenarios where we've seen out in public where people are wearing a mask under their nose. Although they're covering their mouth, they're not covering their nose. And that's still an opportunity for the infection to spread. And obviously, if we don't wear our mask, we're not helping anybody. There are also scenarios where people are wearing masks that have a filter. The Centers for Disease Control does not advise that, because if we are infected with the virus, we could still be spreading the virus around to others. So that's an important thing to remember. And I've also seen people out in public wearing just face shields. This is still under investigation right now, and this has not been endorsed by the Centers for Disease Control for a good prevention in terms of spreading the infection. So an important point that Dr. Gazella brought up is vaccination. And in addition to the point of vaccination, a big question of boosters have come into play. And I wanted to share with you a recent study that was released from Israel. What they did was this: they evaluated over 1,900 healthcare workers in Israel, and they divided them into two basic groups. One group had 2 doses of the vaccine, and then the other group basically had the 2 doses of the vaccine plus the booster shot. And they compared which groups basically had, breakthrough infections with COVID-19. And what they basically found is that those healthcare workers that were vaccinated and boosted basically had significantly reduced lower rate of COVID-19 infection compared to the ones that just had the 2 doses of vaccination. So this is a reminder not only to get vaccinated, but if you are at least 5 or 6 months out from your second shot, to consider getting your booster shot. So another critical piece is this: since the virus is spreading, and since we've actually seen some breakthrough infections with people, it's important to understand what we need to do in a situation that is critical and emergent. So if there's anything that you get from my talk today, that's this slide. So what are the warning signs to look for before you call an ambulance or call a healthcare provider or call 911 and seek immediate medical attention? And that is, if the person is having trouble breathing, if you see somebody is having persistent pain or pressure in the chest, new onset confusion, that could be another sign, inability to stay awake or wake up, that's another sign to call 911. And if you see that a family member or a loved one is looking pale, gray, or blue-colored skin, lips, or nail beds, that might be another sign that you need to get immediate medical attention. So just to summarize this real quick, when do we call 911? Basically, when we see somebody that's having trouble breathing, pressure in the chest, new onset confusion, inability to wake up or stay awake, or changes in that skin tone in terms of pale gray or blue colored skin or lips or nail beds. So these are things to look out for. Now, just to summarize, what can we do to protect ourselves while we are in this pandemic? Well, it goes back to the basics, and all of you know this, but I'd like to just re-emphasize this. Be sure to wear your mask above your nose, over your nose, and over your mouth. Make sure it's where you're wearing it correctly. Social distancing is still very important because, as Dr. Gazella mentioned to you, how fast this virus can spread. And also remember the basics of washing your hands with soap and water. And do not forget to get your vaccine and booster shot. With that, I'd like to turn our attention to the homeopathy perspectives from Dr. Chopra. Thank you so much.
Dr. Chopra, can you unmute yourself?
Good morning, everybody.
We can hear you.
Regarding Omicron and other viruses, variants related to COVID virus, Dr. Ghai, homeopathic management definitely play a very important role. And the most important we can do homeopathically that generally in acute illness, we go for medicine on the very short base of symptoms. Like we can say that we can collect 3 or 4 or 5 symptoms of the patient and prescribe the homeopathic medicine. Some of the homeopathic medicines which work very well, especially in general viral illness and also COVID, is arsenic and delphinium. We can also have brania, nux vomica, pulsatilla, and there are few more remedies which are definitely given symptomatically. Genus epidemicus, which means the common remedy given to the community as a preventive medicine, is arsenic. The drug of choice is arsenic. Definitely the potency is arsenic 200. But today I want that you should know when arsenic should be given and why arsenic should not be substituted with gelsemium or nux vomica, or it may be brania, because every medicine have its specific set of symptoms which are known as the keynotes of the remedy, the red line symptoms. Definitely arsenic is a popular medicine which is indicated in maximum number of cases. In Omicron also. Omicron also, I had seen arsenic is well indicated. Before Delta virus also, the arsenic as medicine also covers the Delta virus. First of all, the most important symptom, which is very important to give arsenic, to prescribe arsenic, is anxiety. anxiety should be present. We can say that 7+, and it can go maximum up to 10. Second, the patient is generally thirstless, or the patient drinks a very little amount of water. Bar, we can say that repeatedly having only sips of water, not consuming the large quantities of water. If the patient consumes the water, it's just a sips of water. Third symptom, which is very important when we have to prescribe arsenic, is general weakness, cold and clammy skin. We can say that the patient can go into a state of collapse, and arsenic can definitely protect worsen the condition. So arsenic is strongly indicated when these symptoms are present. Otherwise, we have to search the different set of remedy. For brownie, the most important symptom is indifference. This is the mental symptom that means indifferent. The patient is not very much keen or a little bit rude during the time of illness. Second, severe pain, which is relieved by very hard pressure, a type of myalgia which got relieved by a hard pressure. Thirst with a very dry mouth, or no thirst with a very dry mouth. So brania can be indicated. Anxiety is not so much prominent in brania as much as it is prominent in arsenic. So when you see the patient is more anxious as compared to his status of illness, arsenic is very strongly indicated. Camphor is one of the medicine, and brania dose is also 200. We will go with the 200 potency always, as it is the medium potency and it act well. And if disease is very much clear in the symptoms, so we can also camphor. For camphor, we have a cold and clammy skin, and the patient is on the verge of collapse, and very, very deep breathing is indicated in camphor. Camphor 1 ml dose definitely protect the patient from the severity of the illness. We do not have only the respiratory symptoms of viruses, including COVID. Omicron, we have gastrointestinal symptoms also. So sometimes we see nausea and diarrhea in the patients suffering from viral illnesses. And pulsatilla is one of the medicine which is indicated if the thirst is near to zero and there is a general diarrhea which is aggravated by eating anything. The patient digestion become quite weak because of the presence of viral load, and pulsatilla is strongly indicated. Again, the potency is 200 and 1 ml. Generally, in my practice, in my OPD, preferably the when I studied the data, the arsenic is very much indicated. In maximum number of patients, arsenic is indicated. But if few patients have strong gastrointestinal symptoms, pulsatilla is also indicated. The other remedies like brania, camphor, they are also indicated when there is a community spread of mild Omicron. I reside in Karnataka, and I can say that every person symptomatically or asymptomatically is affected by this COVID virus, Omicron. None is spared. Some have symptoms, some have no symptoms, and most of the general population who are visiting the civil hospital, they are not getting their antigen or RT-PCRs done on a routine. Only if the government is doing the mass testing in schools, and if the person is going to different states, and if they are going to the foreign land, they are getting, when they are getting tested, so most of the patients are coming positive, and especially when they are in the hospitals for any planned surgery, and when they got tested they are positive. And the most important uh, aspects of the homeopathic medicine regarding the treatment of COVID-19, when the majority of the population got panicked because of what had happened in the Delta strain, during the Delta strain, is the panic state, and many people face the uh, uh, hopelessness, a type of definitely tragedies. And Ignatia is one of the medicine which helped a lot during that period. And even when now also, because of what had happened previously, the panic state exists, Ignatia is very strongly indicated. Ignatia is a medicine which help us to get out of the post-traumatic stress disorder, we can say this, and also the immediate panic state, generalized anxiety, which occurred because of some uh, immediate indispositions, like the spread of epidemic, or it may be some other situations like earthquakes and or maybe any disasters which happen. Ignatia 1M is very strongly indicated. When there is no clinical symptoms related to COVID illness, but a type of reserved displeasure which had happened uh, because of the hopelessness which had been uh, in homeopathy as R&D to contain this COVID virus. I more can be done because the treatment is very simple, and we can approach the maximum number of population with the very easy method of prescribing the medicine. The initiatives should be taken by the NGOs, by the different seva groups, and on the individual level also. But the panic state which had been created previously and now also, in which the management of Delta strain needs a lots of hospitalization because of need of ventilators and oxygen, demoralize the other system of medicine, specifically homeopathy, as the patient got very little time. Many times a patient do not get enough time uh, uh, to get the treatment done through these alternative means, as the saturation level falls gradually, and they need the management through different uh, means like oxygen and ventilators, etc. Some more medicines uh, can help in homeopathy. One which is also not very tested, like you can say that Rustox. Nowadays with Omicron, the symptoms which is very prominent is backache and the pains in the both of the knees and legs also. So uh, Rustox is one of the medicine which definitely helps when there is uh, pain in the back muscles and pain in the joints. Euphorbarium perforatum is also one of the medicines. It is also given in fever of dengue virus in India, but we can say that it's a we say that it's a कमर तोड़ बुखार जिसको हम कहते हैं हिंदी में, यहाँ पे common language में. Euphorbarium is one of the medicine which is very strongly indicated. Euphorbarium perforatum. This medicine in which the bone pains is very severe. I'd seen many patients coming nowadays with the severe pain, patients a lot. So this is the red line symptoms of Euphorbarium perforatum, that severe pains in the bones. Again, as Omicron is very contagious, it's spread very fast. Definitely, pathogenicity is, as said by you all, is quite less, and we are seeing that hospitalization is not so much, and we are very hopeful that the things will be fine earliest. Homeopathy individualizes each and every case. It is a boon also, and it is a drawback also, because when contagiosity is so much, the virus is so much contagious, then so much individualization is not possible. We can't treat each and every patient on the basis if the patient daily more than 100 patients in Karnal only there is 400 new cases daily in chief medical officer's control room. Daily address near about 400 isolated cases, and so many cases daily, and old cases also. It's not possible to individualize every case. Genus epidemicus, which I am saying, when the medicine is very common in the community, like number one, pain in the back, severe headache, and we can say that scratchy throat and dryness of the throat. If these symptoms are covered, so again the medicine which is indicated strongly is arsenic. And what I had seen in the Omicron dry cough, but with Omicron, cough is productive. So it's also an indication towards the remedy that we can prescribe again arsenic as a genus epidemicus in the community. So we can do good with homeopathy, we can do better with the homeopathy. The only drawback which I'm seeing in OPD and through telemedicine and telecommunication is individualizing each and every case, which is difficult and in this way, as every case present a different set of symptoms and the remedy is always a different. Some patient got indicated with pulsatilla, some with brania, some with arsenic, some with gelsemium. So few remedies I had described here according to the set of symptoms, some common remedies. It become a little bit easier for all of you to have a little bit of self-medication. And thank you very much. That's all on my part. Questions are welcome. Thank you so much.
Yeah, thanks, Dr. Samarth Chopra. Now we present to you the Ayurveda perspectives. So Dr. Neeraj, floor is yours. Dr. Neeraj.
Good morning.
Yes.
Good morning to all of you. Okay, ma'am. Good morning to all of you. First,
Dr. Neeraj, we cannot hear you.
and okay, ma'am. And first of all, I would like to focus on the what is the guideline of Ministry of Ayush, especially concerned to Ayurveda. Basically, Ministry have prescribed the two sections. First is preventive aspect and second is treatment aspect. So if we see the preventive aspect, Ministry advised that if for in this third wave, first is Ayu Raksha kit. In Ayu Raksha kit, we mainly take Chyawanprash 6 gram once in a day. Second is Ayush Quath 75 ml once in a day. Third is Sansamani Vati 50 mg 2 times in a day. And fourth is Anutel, which is used in each nostril as a Nasikar. And second is Gurchi Ghanvati, that is 50 mg twice in a day. And third is a Sugandha tablet. This is approximate 50 mg twice in a day. These are the preventive aspect. And for best result, we can use mainly Ayu Raksha kit and Ashwagandha tablet. As we know that Sansamani Vati and Gurchi Ghanvati both are same. And for the aspect of the treatment aspect, Ministry advised that one of the medicine that is Ayush 64. Ayush 64 for the patient that is RT-PCR positive but asymptomatic, we can give 2 tablets of 500 mg twice in a day, means 1 gram BD. And for the patient who is RT-PCR positive and have mild to moderate symptom, in that case we can give 2 tablets 3 times in a day, means 1 gram TID. And next slide, please. As you can see that the Ayush 64, this medicine is a polyherbal formulated drug used, has been tested for the treatment of asymptomatic, mild and moderate cases. And this medicine is used as a protocol by the guideline of National Clinical Management Protocol. And this medicine is basically developed by Ministry of Ayush as a wing of the CCRS. This medicine was developed as a medicine of the malaria, but now it is used as a asymptomatic, mild and moderate cases of COVID-19, especially in third wave. Next slide. As we can see that in this wave, Ministry advised about the holistic health. And holistic health is concerned to the physical health, mental health, and social health. And Ministry also advised about the the third wave, diet should be light. And ministry also advised some of the yogasan that will be very helpful for the mental health. So in next slide, ministry advised about the 5 asana that is okay. Next, ministry advised about the 5 asana. First is Surya Namaskar. As we know that Surya Namaskar is about the combination of the 12 pose. And in 14th January, government of India celebrated this Surya Namaskar as a and after that we can see that some of the asana like Padhastasan, Ardha Chakrasan, Makrasan, and Bhujangasan. And another is for if any person is COVID positive and suffering from some of the respiratory distress, that can be in that condition we can use chair breathing exercise and pranayam and yogic relaxation technique. And after that, in next slide, ministry advice some of the what to do, what not to do in these conditions, means what to have and what to avoid. And what to have, ministry advise about take plenty of the warm water along with lemon and honey. Add spices in your daily food. Prepare food that are low in oil and fat, and have a protein-rich diet. And use zinc, selenium, and vitamin C rich food like lemon, orange, oat milk, and drink at least 1 glass of yogurt each day. And what to avoid in that condition, Ministry of Ayush advised that avoid cold beverage, especially cold drink and aerated drink. Avoid refined sugar or reduce salt intake, and stop smoking and alcohol. These all about the aspect of the Ayurveda in this Omicron virus, in this third wave. Thank you. Thanks to all of you.
Yeah, thank you, Dr. Neeraj Srivastava. And it's a great, excellent presentation by all the doctors. So I want to thank all of you, Dr. Jawahar Ghazala, Dr. Hans Gai, Dr. Samar Chopra, and Dr. Neeraj Srivastava for sharing the insights on COVID and the Omicron growth and expansion. You have highlighted all the points: vaccines, the booster shots, the treatments, the precautionary measures, up-to-date information on Omicron, and also what to do, when to call 911, when to seek emergency, and also the homeopathy and Ayurvedic perspective. So I really want to thank all 4 doctors for taking time and sharing these insights with our lovely audience. With that, let's move to our question answer session. And there are some questions there. I'm gonna ask the questions, and doctors, you can answer these questions. So some of those questions have come to me direct. It has not been shared by all. So I'm going to read those questions, and you can take a stab on that. So the first question that was direct to me is Delta subsided? So Dr. Jawahar, Dr. Hans.
Yes. So for all practical purposes, yes. I mean, to say 98% of all confirmed cases are close to Omicron now, at least in the United States. So for all practical purposes, Delta will be driven away by Omicron. In India, probably the percentage is maybe less. Maybe Omicron could be 60-70% or somewhere there. But ultimately, Omicron will drive away Delta from circulation. That's my take on it.
Yeah, thank you so much, Dr. Jawahar. The next question is, Pfizer effective against the Omicron? Is Pfizer effective?
Yes. Yes.
Okay.
So I just want to add, so there is Pfizer vaccine, which is effective as Hans pointed out. And now there is an antiviral from Pfizer called Paxlovid. That also is very effective.
Okay, yeah, no, thank you so much. The next question here is from Shantiji. Are these over-the-counter medications or do they need to be prescribed by your doctor? And
so the Paxlovid and Molnupiravir, they have to be prescribed. You have to have a positive test, and the doctor will see whether you're a candidate for it, because you need to, at this time, they're still very scarce, the medicines. So you have to be a person who will go on to get hospitalized, or your risk is high, then probably the doctor will prescribe it to you.
Okay, thank you, Dr. Jawar.
Hans, you want to add? Or?
No, I agree. This is something that will need to be prescribed.
Okay. So other question is from Chandrasekhar. I have taken COVID Shield 2 doses in India, and now it's been near to 6 months. Can I take a booster now in USA?
Yeah, the general answer to that is yes. Many of the experts will also say this, but let your doctor know that you had the COVID Shield before. But the general answer to your question is yes.
Okay.
You can take that booster.
Thanks, Dr. Gai. The next is the observation here, a comment here by Raghu Konda. The first COVID was severe, Delta was much more, and Omni very less. Omni going to help make this kind of seasonal flu, or the virus can become strong like the Delta. So it's a comment here. Would you like to say anything on this?
So my perspective is it's all God willing that we don't end up with another variant which comes out of Omicron. Like, for example, from the native virus came the Alpha variant, then there were other variants, and then came the dangerous Delta variant, and now comes the Omicron. So when the virus is infecting lots of people, there is a very high likelihood of a new variant emerging, because the virus is replicating. So there is always chance for mutations to happen. So when the replication process is higher, the chance of a variant is higher. So at this time, the replication process is very high. Number of cases are very high. So the chance of a variant coming is possible. And that variant could be even more severe than Omicron. So Omicron is severe, but there is a lot of natural immunity in the community. So we don't see the number of hospitalizations and deaths. But a new variant could be something else. So hopefully we have to pray and control this real well faster now to prevent a new variant from coming.
Yeah, I would agree with that. Absolutely. We hope that it doesn't turn into something more dangerous from what we have right now. Certainly, this is a virus that is able to infect a lot of people. However, when it enters a body of an individual, it is definitely replicating. And when it replicates, as Dr. Ghazala mentioned, it's making new changes. And when it's making those new changes and it's going from one person to the next, it's again, and that other person, it's making new changes. So that's the reason why we really emphasize the basics, wearing your mask, social distancing, washing your hands, getting your vaccination and booster, so that we are putting this virus into check and therefore not having to deal with a super crazy variant that's spreading fast and infecting a lot of people in a bad way. Yeah. So to answer the question, we hope not. And that's the reason why we practice all those measures that we all know and love.
Yes, I absolutely agree. Thanks, Dr. Gai. Any other doctor wants to share insights on this? All right, let's move to the next question. The next question is from Malti. Already my kids took first 2 doses of vaccine. Are there any dangers in giving vaccines to children? There is not much research on the effects of these vaccines. Also, I'm reading that there is a lot of negative effects in long run. Any remedies in Ayurveda or homeopathy? So Ayurveda and homeopathy and also allopathy. Dr. Samarth, Dr. Dheeraj, you want to start first?
Ma'am, please repeat the questions.
Sure. So the question here is, are there any dangers in giving vaccines to children? There is not much research on the effects of these vaccines. Also, I'm reading that there is a lot of negative effects in long run. Any remedies from Ayurveda and homeopathy perspectives?
Ma'am, first of all, as a preventive aspect, I would like to advise some medicines like for improve the immunity in children. We are doing Sword Prasan. This is a procedure in which Sword Bhasm is given along with Madhu and Grit to children to improve the immunity. And second is now at current time we are using golden milk concept. In this concept, we are mixing the turmeric powder with milk, and this will also improve the immunity in children. And some of the symptomatic treatment, like if child suffer from cough, then we are using Sitopalade Churn, Thalisade Churn, and Amritarist. If child is suffering from GI disorder, then we are using Bal Chaturvadra Churn. And if child is suffering from indigestion or loss of appetite, then we are using Arvinda. So then some of the symptomatic medicine is also available, and some of the medicine is available to improve the immunity in children. So we are focusing in the preventive aspect and treatment aspect both in this condition.
Yeah, absolutely. Definitely, we have to take both sides of the coin, right? The preventive.
I want to add
please.
here that I mean the vaccination is safe for kids. It's not like so it's been approved by FDA after thorough review, and these vaccines, mRNA vaccines, are very safe. Both my kids got it. One of them is more than between 12 to 15. The other is less than 12. So for all practical purposes and the evidence we have and the data we have, they're safe. So not to be worried. But appreciate Dr. Neeraj Srivatsava's advice, where we can use alternative medicine to improve immunity and treat conditions.
Right, and I would actually second that as well. There has been numerous studies in children, and I think even as healthcare providers as well as family people, we are really we share concerns that people would have, and even looking at the literature as well as talking to the experts that have been doing the studies in children. The results are that it is definitely safe in children. So I would keep that in mind as you're thinking about vaccination for your children.
Okay, thank you, Dr. Hans Gai, and also Dr. Neeraj. Dr. Chopra, you want to add anything to it? Okay, let's move forward. So the next question.
He's on mute, Madhuji.
Dr.
Yes.
Samarth, can you unmute yourself?
Yes, sure. Actually, we do the things as per the data. Definitely, vaccines have a real-time data. They had proved, they are by sure that vaccines are very safe for the children, and they are given. Definitely nobody have the guts to say no to the vaccines. If we got a choice, definitely maximum number of population, majority of the population is going with the vaccination. They got themselves and their children vaccinated. And we also can't deny the alternative treatments, homeopathy, Ayurveda, both works and both works very well. We have to create more and more data. We have to put more and more inputs regarding the medicines. As Dr. Neeraj also told, they are using Sitopaladi Churan and different of their remedies to treat symptomatically. Same with homeopathy. Symptomatically, we do very well. Even I had talked about genus epidemicus, like arsenic, which definitely helps the population. But we have to create a very strong data. What is actually happening? We have vaccines have no cut corners. We know that. They are introduced after thorough investigation regarding their safety towards adults and children. Homeopathy and Ayurveda both are 100% safe and natural, no doubt. The only thing is that we have to, the people have to choose whether they have to put both of these systems on priority and do not get vaxxed themselves. I said never do that. The best thing is we should have integrated approach towards conquering this Omicron or Delta and other viruses, which happens to be quite deadly. So integrated approach is the best. Homeopathy, Ayurveda, allopathy, everybody have a same mission to end this nasty virus. So, and we give a weightage on the part, if treatment is safe enough to be given to the children, or it is more risky that it may jeopardize the life of the kids all and all that. When we know that safety is enough that we can take the risk, definitely we'll go with the remedies, go with the vaccinations and the remedies, whether it may be the part of any institution, allopathy, Ayurveda, or homeopathy. That's all. Thank you.
Yeah, no, thanks, Dr. Samarth, and I absolutely agree. It has to be integrated approach. So thanks for bringing that forward. And the next question here is related to integrated approach only. So Lakshmi wants to ask, can you mix and match medicines, allo, homeo, and Ayurvedic, any side effects? So what you just said, Dr. Samar, the question is also about it. Can you mix and match medicines, allopathy, homeopathy, Ayurvedic, and is there any side effects?
Homeopathy can be very strongly given parallel to the allopathy. And the only thing we say that you should keep the time difference. If you are giving allopathic medicine at 10 a.m., so you should wait for another 2 hours to prescribe homeopathic medicine. Moreover, the allopathic medicine works on the physiological scale, but homeopathic medicine works through nerves, and it is based on the very much quantum mechanics theory. So it is on the different level. It's on the different level. The frequency is totally different. It's just like you have a frequency modulation on radio, and one is AM. So it's different. The frequency is different. So no issues with allopathy. And with Ayurveda also, it is also a holistic approach and it treat the patient as a whole. So Dr. Neeraj Srivastava is much more competent to answer this question. Please, Dr. Neeraj, you can.
Thank you, sir. As everyone is know that all the Ayurvedic medicine is mainly herbal medicines. Means in some cases we are using herbal minerals, but in the case of herbal medicines there is no chance of side effect. So I think the timing of the to take the herbal medicine should be fixed. I think 12 a.m. 8 a.m. means the timing should be fixed, and there is no chance to side effect.
Awesome.
In the some cases we are using bhasma, and if their manufacturing is not good, then in that condition in some time nephrotoxicity and something is developed. But if their manufacturing is proper, and if we take the medicine from a standard company, then there is no chance of side effect.
Okay, yeah, that's really good to know. Thank you so much, Dr. Neeraj. Now, Dr. Jawahar and Dr. Hanskai from the allopathy side, do you want to say anything? Any comments on that?
From my side, I think in this COVID pandemic, allopathy, homeopathy and Ayurveda have really come to the fore because, for a long period of time, even now, the amount of quality medicines allopathy can offer is still less. So it's always good to, if allopathy offers something, it's good to take it with less side effects, but always have an integrated approach and use Ayurveda and homeopathy as a part of preventive and also treatment for both prevention and treatment. I don't think they all can work together.
Yes, very well said. Dr. Hanskai?
Yeah, and I would agree with that point that the rest of the doctors brought up. And I also think it is important that we do discuss this with our physicians and let them know what we are taking so that they are also aware. That also becomes an important communication piece between our healthcare team and us.
Okay, yeah, that's very important. Thank you so much, Dr. Hans. The next question is towards more Ayurveda. Is Sitopaladi can be taken in pregnancy and in COVID, and also how much is the dose?
Yes, ma'am. Basically, for pregnancy, we can take 3 medicines. First is Sitopaladi, second is Talisadi Churn, and third is Amritarist. So all the 3 medicines are safe during pregnancy, and the dose is 4 to 8 gram 12 hourly. Means it will be the exact dose will be decided on the basis of prakriti of the person, but the range will be 4 to 8 gram per in 2 times in a day.
Perfect. Thank you so much. And there's another question for you, Dr. Neeraj. Is any Ayurvedic remedy specifically taken in pregnancy for cough because of COVID?
Yes, ma'am. Is in this period, Sitopaladi and Talisadi both are safe.
Okay. All right. So thank you so much. And now the next question is by Jyoti. And she's saying, if someone gets Omicron, are they still supposed to take booster shots? How good are antibodies after one gets COVID? Dr. Hans, Dr. Jawahar?
So basically, if you have COVID, wouldn't get a booster for at least 90 days afterwards. And so basically after 90 days, I would talk to your doctor about whether it would be safe to proceed with that or not. So especially if you've had an infection recently, I would not get any vaccination.
And how good are antibodies after one gets COVID?
Right. So that's a fantastic question. So people are ordering antibodies, and the testing of the antibodies are still being validated. They're more used in the research setting than they are in terms of true clinical practice. I realize there are many physicians that are ordering it and sometimes making decisions based off of it. But I think I'd like to also emphasize there is not a standardized system looking at this, and therefore it's only used in a research setting to make any determination what needs to be done next. So just be aware of that.
Yeah, sure. Thank you so much. Going to the next one, Maltiji is asking, I took booster shots 2 weeks ago. I know we have to take vaccine to save ourselves from COVID. I am still having chills after booster shots. Will the vaccine damage nervous system, as I already have some issues from past back injury and paresthesia?
Yeah, the chances of the vaccine damaging the nervous system is very low. However, I will have to say this, that there could be some rare side effect that an individual can experience. And it is important that you discuss your medical history with the doctor to make sure that you may not have anything that's exceedingly rare going on. In terms of the feeling of sluggishness, as well as some chills and things of this sort, if it does not resolve in the next few days with more supportive care, then I would definitely seek attention with a physician to make sure there's no other infection that's brewing at the same time as the fact that you've already had the booster shot and you're having some effects from that plus something else. So just another thing to just to be aware of as you are progressing over the next few days.
Yes, I absolutely agree. It's very well said, very well answered. Thank you, Dr. Hans. Dr. Jawad, anything to add to it, or can we go to the next one?
I agree with Dr. Hans on that. Very rarely vaccines have caused like Guillain-Barré and kinds of stuff, but I don't think it's the case with that questioner because it's been 2 weeks since the booster dose. So she should be fine.
Okay, yeah, thank you so much. Next question is by Hari. So a lot of people are traveling to India. There is a special occasion, inauguration of Statue of Equality in India in Hyderabad. So the next question is pertaining to that. Prophylactic, homeo and Ayurvedic for individuals traveling from USA to India. So any insights, people traveling, what precautions, and in regards to prophylactic, homeo, and Ayurvedic perspectives for the people who are traveling from USA to India.
Okay, ma'am. First of all, I would like to give answer. First of all, we should follow the COVID appropriate behavior in India. And second, after that, some of the preventive aspect, as I described in my first slide, that we can take the Ayu Raksha kit. In this kit, there is Chawanprash, Ayush Kadha, Sugandha Churn, and Sansamani Vati, 4 drug preparation. It can be used as a preventive. And along with this, we can use some of the medicine which improve the immunity of the person, like the fruit that is rich in vitamin C, or the fruit that is rich in zinc and vitamin D3. And as we come in the intervention approach, then Ayush 64 is one of the medicine that is come after the research. And this medicine can be used if person is RT-PCR positive, and that case is asymptomatic, mild, and up to the moderate cases. And in severe case, we go for the allopathic medicine.
Awesome. Awesome. Thank you so much, Dr. Neeraj. Dr. Samarth, you want to add anything to it? from homeopathy perspective?
Yes, we can definitely take the genus Epidemicus, which is arsenic album 200 once a week, 2 drops, 1 or 2 drops once a week for 3 weeks. And we can say that in India, it's not quite possible. If the people, definitely the people are coming from US when they are trying that they should not got COVID, it's a little bit difficult. One of the most important reason is the dense population. Second, the people do not follow the norms regarding the COVID appropriate behavior, which is quite missing here. Now with Omicron, the mask is also upgraded. N95 is recommended very much. Previously, the cloth mask is indicated. Majority of the population here in India even do not use mask. Forget about the cloth mask or the N95. And we also, we just like a defensive driving, we say that how the other person is driving, we have to protect ourselves. But in this case, in the case of Omicron, it is little bit difficult to be defensive also, as it is very contagious. So during this peak, coming to India is should not be motivated, and if it's absolutely necessary that anybody wants to come here, then we have these options. We have these limited options only. Not much we can do. It's a very hard truth. It's a fact.
I agree. Absolutely agree. So any travel precautions, Dr. Jawar, Dr. Hanske, you mentioned a lot of precaution. Any travel precautions you want to bring it to the limelight right now?
Madhuji, I'd like to add, make
please.
sure they take their booster shots, number one, before they go, and make sure they use a good surgical mask, at least a very good surgical mask. And I think Indian government has a 7-day quarantine if somebody is coming off outside India. So that would be a big hindrance. 7 days you have to quarantine. And then you can use, as Dr. On top of that, you can use, as Dr. Samat pointed out, arsenic alba. And as Dr. Neeraj pointed out, you can use sitafal churni and and other stuff. But yeah, I mean, you have to. I mean, there's a high chance it's spreading wildfire in India. So at this time, Omicron. So they're very high risk to get it.
I agree. Absolutely. That's the truth. Dr. Hanske, anything to add to it?
I have nothing to add. They've, I think, covered all the real bases.
Okay, perfect. So the next one is, there's just a comment, vaccines are safe. Yes, Raghuji, we know that. Next is from Lakshmi. In fact, infants under 2 years can be vaccinated. Can infants under 2 years be vaccinated? Dr. Hans and Dr. Jawar?
Not under 5.
Not under 5. Okay, so any precautions for those young children?
And we don't put masks on in children under 2. So that's also another important piece. And obviously, if we are infected, we don't want to expose these young children. And we don't want to put these children in an environment where they can get it from others. So that's another important piece as well.
Yeah.
So it kind of goes back to what Dr. Chopra, Dr. Suresh, and Dr. Gazella were mentioning.
ఆయన దాంట్లో మసాలా వేసుకుంటాడు, అదే వేసుకుంటాడు, వేరేది వేసుకోరు ఆయన.
Please mute your lines. Sorry.
It goes back to what the other physicians were saying, that there's that issue of prevention, and I think that's kind of our key step with children.
I agree, absolutely. So there's another comment here. Remember the days our parents carried us a couple of kilometers to get the important vaccine like polio. So yes, Raghuji, vaccines are safe. Now the next question is, number of 5 years below the vaccines have not been approved. Yes, that's correct. That's what Dr. Hans mentioned. Jyoti said, if kid got Omicron and second shot is pending, when is it a good time to get the second shot? Dr. Hans and Dr. Jawar?
Yeah, so I wouldn't get it right away. I would at least wait at least 90 days. And then I would consult with your physician before taking the next steps on the booster. Anything else, Dr. Gazella, on that one?
Yeah, same. I would wait. I mean, personally, I would wait for the new variant to pop up.
Okay, yeah, absolutely. I agree to that.
Anyway, the kid is had a vaccine, partly vaccinated, and she had the kid had the Omicron, so she's at least has natural immunity against Omicron. So I mean, personally, it's I would wait till new variant comes out,
Sure.
and see how it's going, because there could be new vaccines. I mean, the pandemic has to play out, and then decide.
Absolutely. That's a good point here. The next one is from Raghuji again. How dangerous is COVID for people or kids with asthma compared with normal population?
I mean, the risk will be a little higher, but you have to make sure is the kid less than 5 years, Madhuji?
So it didn't mention here. It just mentioned like how dangerous it is. And the second part of the question is also there. What more precautions should people with asthma have to take to be safe?
Yeah. So if the kid is more than 5 years, obviously you want to get vaccinated and boosted, depending on their schedules. And you control the asthma really well from going forward. You never give lenience to asthma like it's a winter season. So you keep your maintenance drugs really well and be well prepared.
So the age of the child is 17 years and ready to start the college. Dr. Jawar.
So you get vaccinated and boosted as schedules, and make sure you exercise daily, follow the yoga regimens as prescribed by Dr. Neeraj, and because yoga does help. I'm an asthmatic too, so it does help. Physical activity, yoga, and breathing exercises does help in asthma control. And keep your maintenance drugs, maintenance inhalers. Do not miss them. Keep yourselves, please take your drugs well and hope for the best. Keep well protected with masks, social distancing, and avoiding dangerous situations, to prevent yourselves from getting Omicron. So those are the things.
Yeah, all right. Thank you so much. We are a little exceeding on our time. So let's go through these questions really quickly. Can homeopathy here, the belladonna 30, can be used as a preventive measure? So Dr. Samarth.
Yes, sure. Belladonna is a very good medicine, and it's also we can say that it can be used in any of the viral fevers, scarlet fevers, and strongly indicated in COVID also, depending upon the symptoms. The symptoms which indicated the belladonna is first suddenness. Suddenness is one of the most important symptoms of the belladonna. The person is quite well with no symptoms, but suddenly a kid or maybe adult have a very high fever. The redness is second of the symptom. The skin becomes red, the cheeks become red. Third, the redness, we can also say the inflammation is also quite high. Throbbing headache, one of the very important symptom of belladonna is a throbbing type of pain. And the patient want to pull its hair badly so to relieve the pain. So belladonna is definitely indicated, but some of the set of symptoms I had mentioned indicates the belladonna well.
Sure. So next question is also related to homeopathy, Dr. Samarth. The question is, arsenic alba 30 be used for prophylactic, can be used in 12 years? And if yes, then what doses?
Arsenic 30 is also can also be given, but arsenic 200 is also well indicated. Arsenic 30 can be repeated after every 5th day for 3 or 4 weeks. Arsenic 200 is once a week is enough for 3 or 4 weeks continuously. Because you know that arsenic is a very poisonous substance. So we generally potentize it to such a level that it do not have any poison. We just have the energy of that particular substance. And through that energy, which is manifested in the form of symptoms, we use arsenic. So definitely if we do excess of the regarding the remedy, it will harm. We should not use any of the homeopathic or even I think of any system, the medicines in excess. It should be avoided. So as recommended, arsenic 30 every 5th day for 3 or 4 weeks is enough. Arsenic 200 once a week for 3 or 4 weeks is enough. After 2 or 3 months, you can repeat this thing again and again. That's all.
Awesome. Thank you, Dr. Samarth. And there is a direct question to me is, what is your advice of taking of new flu shot for those who have not taken the booster shot? So Dr. Jawar and Dr. Hans.
So Madhuji, yeah, go ahead and take flu shot and booster at the same time.
Okay.
Yes, and that has been also recommended by infectious disease experts as well. So that should be fine.
Perfect. Use drops or pellets. I think it's related to the same old question. And yeah, so the 1 or 2 questions more popped up, and I know we are running out of time, but let me just address last 2 questions. Boron arsenic 200, okay for prophylactic dose. These are available on Amazon. So Dr. Samarth. So
ma'am, if you can repeat the question, please.
Yeah, so it's a boron arsenicum 200, okay for prophylactic dose. These are available on Amazon.
Yes, it's good. It's quite good. Yes, boron is a very good brand, and it is if it's arsenic 200 of boron, it's good. It's very good. Boron brand is very good brand.
Okay, awesome. Thank you. So the last question here is, do kids need to wear N95 at schools since they are tough to breathe? So
Hans, you want to take it, Hans?
Sure. There is no recommendation that I've come across that children need to wear an N95 at school. I think a basic mask should work for a child in school. So I think that's something that would be all right. But as long as a mask is worn properly, I think that is the key. If a mask is worn properly, many studies have shown that it definitely is very helpful in terms of avoiding getting infected. Dr. Gazella, is there anything else you wanted to add?
No, I agree with Hans.
So, all right, I think that concludes our session today. And as mentioned by our doctors, the holistic integrated approach is the best approach. And the findings or the information that is shared today, we always recommend that you consult your doctors first before starting any of these medications. That's very, very important. This presentation is to share the information a very high level from allopathy, homeopathy, and Ayurvedic perspectives. And I want to thank all my listeners here. I hope you find it useful, you find it valuable. And we will share this recording with you in case you want to look back into what was said in Ayurveda or homeopathy or related to booster shots. And I really, truly want to thank all our doctors here, all the 4 doctors, Dr. Ghazala, Dr. Hanskai, Dr. Samarth, and Dr. Neeraj Srivastava for your time today, sharing the insights on COVID, and also, answering all the questions very well. So sincere appreciation and heartfelt thanks from my side to all the doctors for helping our community in this tough COVID environment. I also want to thank all the attendees today for this webinar. As I said, I hope this is valuable to you. And I wish you a very happy, healthy, and happy 2022. With this, enjoy the rest of your Sunday. And if you have any lingering thoughts or questions, we can connect offline. But this concludes our session on emergence and spread of Omicron. Thank you all. Thanks for attending. And thanks, doctor, for your time and sharing the insights. Thank you.
Thank you, ma'am. Thank you, ma'am.
Thank you very much. Thank you.
Thank you to all of you.